Hi everyone, thanks for joining today's webinar. My name is Adam, Content Marketing Specialist with Henry Schein, and I'll be your moderator. There will be no Q&A for today's webinar. If you have questions pertaining to this topic, please email us at ndo@henryschein.com. Please make sure that your volume is up and any large computer applications are closed to ensure a smooth connection. This webinar is presented by Henry Schein Dental Business Institute, and no CE credits are being offered for viewing today's presentation. Our speaker today is Cindy Bickers. Cindy is the Manager of Nationwide Dental Opportunities with Henry Schein Dental. We will also be joined by Dr. Edward Scammon, who is a general dentist and owner of Hometown Family Dental Centers. Thank you both for being with us today. Over to you, Cindy.
Thank you, Adam. Good evening, everyone. Before we begin the webinar presentation, I want you to know that the HSNDO family hopes that you and your family stay safe and healthy during this difficult time. I understand that we are all concerned with the issues at hand in dealing with the COVID-19 pandemic. But as we begin our new normal, it is best to continue to prepare for your future and the future of your practice. I've been placing dentists and practices across the country for more than 18 years, and I've seen the dental business weather many storms. Obviously, the way you practice and manage your practice will change in the future. Hiring an associate dentist is a difficult decision to make at any time. If you're considering the possibility, you want to do your homework before making that leap of faith. I'm going to share some tips with you that will hopefully help you when you are ready to make that decision. Also, at the end of my presentation tonight, Dr. Edward Scammon will join me for a Q&A session. Since the COVID crisis, you may have decided that this is the best time to bring in some help. In speaking with dentist owners, there are many reasons to add someone to their practice, possibly to cut back on doing dentistry to spend more time just managing the practice, or to dedicate more time to the type of dentistry that you enjoy, or possibly you just want more free time. I'm hoping that your practice is too busy since you've been closed and you have more patients than you can treat with your reopening. If you're booked out 3 weeks or more, you may need an extra provider. Perhaps if you're a senior dentist, you're planning to transition ownership of the practice in the future. Whatever the reason, you want to begin to prepare an attractive opportunity for that future associate or owner. So for tonight's webinar, I've broken our discussion down into 4 short topics. Are you ready for an associate? The benefits of adding an associate, understanding the associate's expectations, and making your new relationship thrive. It is important to prepare mentally as well as physically for a new associate to join your practice, especially if you were not considering hiring prior to the COVID-19 crisis. Adjustments will need to be made. I understand that it can be difficult for some dentists who have worked and built a practice over many years to offer a young new dentist the opportunity to reap the benefits of their hard work and dedication. I've worked with practice owners who feel that the new associate should pay their dues. Sometimes the owner wants to compensate the associate less than they should, or hold back on sharing any good patients with the associate. Think about your mindset before you consider hiring. Will the practice support an additional dentist? Normally, to add an associate, your practice should be growing. But if it has outgrown the number of providers working, you may have to turn patients away. And I know it is probably difficult to determine whether your practice is growing after the COVID shutdown, but you should be able to tell rather quickly once you reopen. Some practice owners I speak with are busier now due to the shutdown. For others, the business is coming back slowly. Also due to the COVID-19, some practice owners are selling their practices sooner than they planned. With the dental business changing, many practice owners are adding those practices to their existing practice. Please understand that purchasing an office doesn't necessarily equate to an opportunity for an associate. There needs to be growth for that to happen. If needed, will the equipment be updated? Do you have the staff to support another dentist? How many hygienists does your practice currently have? Is it expected that the associate will perform hygiene? Since COVID-19, I've actually spoken with some practice owners who plan to add an associate and have them do some hygiene. And this could be a good way for an associate to get started in a practice right now. obviously dependent upon compensation. In the past, this was not the desired opportunity for an associate, but until the practices are all back to normal, this might be a possibility. How many dental assistants does your practice have? Will a dental assistant be provided to the associate? Will you assign one of your experienced dental assistants to the new associate, or are you planning to hire someone? It's best to put an experienced dental assistant with the new associate if possible. This will help the associate learn your policies and procedures. Also, the dental assistant can observe the new associate's interaction and treatment of your patients. Will the office space accommodate another dentist? Will the associate be sharing operatories with other dentists? How will they share space? Are they splitting schedules like days and hours? How many treatment rooms can you offer the associate? As a new dentist starting out, for the first 6 months, one treatment room may be sufficient. But after about 6 months, a dentist's production will be limited by 40 to 50% of what they could produce with 2 chairs in the same amount of time. If average production for 1 chair per month is about $15,000, they need an additional chair to increase their production. It's all about production. You will be able to realize practice profitability sooner by offering more space. More than one provider may increase revenue in the practice while treating more patients. Another dentist can provide more hygiene checks to allow for more new patients to visit the practice. So to increase revenue, that requires a sufficient patient base, or you are not adding revenue. What is the active patient count? There should be a minimum of 1,500 active patients, and that's based on patients seen in the past 12 to 18 months and not patient charts. You should bring in an average of 20 to 25 new patients per month to allow for a second associate or second dentist. An associate will need about 800 patients of their own to be able to produce. And if they're paid based on a percentage of their production, the patients they are given to treat will directly affect their income. In a well-established practice, most of your patients will want to continue to see their dentist, which is you. For some patients, you may need to introduce the new associate to make them feel comfortable with the change. If the patient count is too low, has a marketing plan been implemented to bring in new patients? If you expect a new associate to come into the practice to build their own patient base, this will take time, possibly more time than the associate can wait unless they're going to be given a guaranteed salary to cover their needs until that patient count grows. More than one provider may also increase the value of the practice. And with people talking about selling, this is something to consider. With the practice value being based on generated revenue, the increase in revenue may increase the value. Reactivating patients can be a great avenue to introduce your new associate. So if you're booked out too far, your patients may not be visiting the practice as often as they should. This can cause a patient retention issue. Now your new associate can help you deter this. But if you're considering cutting back on your clinical dentistry, you will not need as many patients. You will be sharing your patients with the new associate. So no worries there. Because of the recent changes, perhaps you're considering just managing the practice. Here is an example of the potential profitability of adding an associate to your practice. So for example, if an associate were to bring in $350,000 in collections for a year to your practice, and that's based on them working 200 days a year, basically 4 days a week for 50 weeks, and the production being $1,750 a day. The dental supplies for that associate at 6% would be $21,000. Office supplies at 2% or $7,000. Lab costs, 10% or $35,000. The total assistant cost at $40,000, and then miscellaneous at maybe 1% or $3,500. So the total expenses for that associate to be in the practice is $106,500. Now, you give the associate their compensation at 35%, and that's another $122,000 or $122,500. And then their cost for Social Security, Medicare, payroll costs is about $9,371. So the total for everything, expense-wise, for an associate in the practice would be $238,371. And that's, again, based on $350,000 in collections. So the net profit on that is $111,629, or 32%. So just look at the numbers, and you can see if you do this times 3 or 4 or more, what the numbers could be. Of course, any change in production, additional benefits, or costs will change the net profit. But there is some profit to be made if the patient base will support it. Also, this shows that there's a good reason to mentor your new associates because you want them to be able to produce. More than profit, there are other great benefits of adding an associate to a practice. Now you have coverage for sick days, vacations, and emergencies. The practice succession may also be assured. And with a partnership or a deferred sale, the associate could be paying money toward ownership over time. So you, as the practice owner, may realize the profits of the sale of the practice today as opposed to sometime in the distant future. A deferred sale is easier for the associate to become an owner of the practice as well. It can be beneficial to both of you by doing that. So many prospective employees check websites as part of their due diligence. We all look on the internet for everything nowadays. So be sure and check your website. Your website should include your mission, your philosophy, your management style, and your community activities. Many dentists use the internet to gather information, so Google your name and practice regularly. Obviously, you can't make everyone happy all of the time, so you may see a complaint. But if given the opportunity and you respond to a negative remark or comment with a positive, sincere, concerned reply, it reduces the negativity of the post. In our business here, we Google everyone, and you'd be surprised at some of the things that we learn. Will the associate be given management responsibility? If you as a practice owner want to cut back on your clinical time, the associate will undoubtedly need to manage the staff while you're out. What experience level should you require? Is the new graduate acceptable? What procedures does the associate need to perform based on your patient? This will also impact your decision about experience required. Are there additional procedures that an associate could perform? So possibly something that you refer out or that you prefer not to do? Perhaps procedures that would aid in the growth of the practice by keeping dentistry in-house. Is your practice more focused on a specific type of dentistry, so highly cosmetic, crown and bridge, pediatric, whatever? The new associate should understand this and be prepared. You want to set a schedule for the associate and try to stick with it. It can be distressing to an associate to add hours to or reduce hours from their schedule as planned. This may not be a good surprise, especially now in light of everyone's recovery. I know that there may be more part-time positions available than full-time. And so if an associate has a commitment to another practice, this change may not work out well for them. Also understand that adding hours to the schedule may not automatically bring in patients. If you have more than one office, will the associate be traveling between offices? If the associate interviews at one of your locations, unless it is explained to them, they will undoubtedly expect to work at that location. It is important for you to be clear about your plans for them. Obviously, all elements of an employment offer are important, but compensation is one of the main concerns for all associates, well, pretty much for everybody. Compensation may be the determining factor if there is more than one good opportunity to consider. So for the practice owner recruiting an associate, you must be more competitive with your offer. Will the associate be paid a draw or a guaranteed salary? The typical guarantee for a general dentist right now is $100,000 to $150,000 per year. And for a specialist, it's $120,000 to $175,000 per year. Obviously, those Yearly figures can be broken down into daily rates depending on what works for you. When you prepare a compensation plan offering a draw or guarantee, give a date for that draw or guarantee to be settled. So if it's monthly or quarterly or yearly, will they be given production reports for that time? Also be sure that the associate understands if you are offering a draw or a guarantee. The words are often interchanged, but they are very different. A draw means that the practice is basically loaning money on the anticipated earnings of the associate. A draw is to be covered or paid back. Will they be paid a percentage of collection, collectible production, or production? This can be confusing to an associate, so be clear. For a GP associate, the average range of compensation right now is 25 to 35% of the associate's production or collections. For a specialist, the average range is 35 to 50%. Normally, a percentage of collections is paid at a little higher rate than the percentage of collectible production or straight production. Is the practice involved in managed care? Will that impact the associate's earnings? All of this is important. And one thing that I always discuss with my customers is that if you offer a draw or a guarantee, you may want to make that versus the percentage. So it's either or, whichever is greater, either the greater of the guaranteed amount or the greater of the percentage. But preparing your offer before you conduct the first interview may prevent some issues. So if possible, it's best to plan your offer before you even start recruiting. You need to understand what you have to offer an associate before you negotiate an employment agreement. Then what deductions will come from their compensation? Who pays the lab fees? Are lab fees deducted from the associate's gross collections or production? If so, the associate pays the same percentage of lab fees as their commission rate. So if they're paid 35% commission, they're paying 35% on the lab fees. Are lab fees deducted from the associate's net collections or production? In this case, the associate pays the total lab fee. It makes a difference in how it's calculated. Who pays the lab if a yearly salary is offered? So many times I hear a salary given to, or an offer of a salary or guarantee given to an associate, and then the practice pays the lab fees or a 50-50 split on the lab. The difference impacts the associate's earnings. Does the associate position offer any benefits? With the cost of health insurance and student loan debt, benefits are more important now than ever. Many of the corporate dental practices offer benefits. Is health insurance offered to the associate to pay on their own, or partially paid, or totally paid by the practice? For student loan repayment or reimbursement, is that offered? If paid for vacation or time off, how much? If they're paid an hourly or daily rate, it is fairly simple to determine their pay for the time off. But if you pay them commission based on a percentage of their generated revenue, it becomes more complex. For paid days, they can be calculated at an hourly rate based on the associate's previous income divided into hours a day. To break it down into an average hourly rate, or just pay them a flat rate, whatever is easiest for you. Reimbursement of relocation expense or allowance is sometimes offered. And then continuing education course reimbursement is given to many associates. We all understand that a practice owner doesn't want to bring an associate into their practice to work for a year or two and then let them walk across the street and take their patients. So you should consider a non-compete clause in your employment agreement. Now with the associates working part-time, it is very important to protect yourself. The non-compete, non-solicitation restrictions should be reasonable in distance and or duration. The distance is usually based on the drawing area of the practice, and the duration is typically 1 to 2 years after the associate leaves the practice. Ideally, it should not be effective during the first 3 to 6 months of employment because the associate at that point in time probably hasn't built a good enough relationship with your patients to actually have them follow him or her. Please understand that I am not an attorney and I'm not giving legal advice, but it is my understanding that some form of a non-compete is legal and required by employers in every state in the U.S. Of course, we all know anything can be written in an agreement, but it may not be held up in a court of law. In some states where the non-compete is unenforceable, the non-compete is written backwards as a business assistance fee. So basically, in return for the practice owner's assistance over the first year or two, the associate would pay them a fee for that training. So it could equate to 50% of the gross receipts of that practice. If you choose to do this, don't make the damages clause excessive. I've heard of $1 million plus damage clauses in some instances, and most candidates will not agree to that, so you may lose a good associate because of it. Now, you begin your relationship with your new associate. That's how you're going to set the tone for the future of your relationship. Be sure to start with a fair and honest mindset. It is much easier to begin at a good point than it is to try to fix a damaged relationship later. Sometimes that's almost impossible to do, as we all know. There are two main priorities of most associates looking for opportunities. A number one reason is the location, or at least a general area. That's the desired location where they want to practice. Secondly, again, is income. They clearly want to meet their financial needs. It is one of their main concerns now. New associates were planning to begin their careers this month or next, and since the COVID shutdown, that time has been extended. And speaking with some of our associate candidates, we can hear their stress and concern. If the associate accepts the position purely due to compensation or location, they still may not stay. Be sure that they're also compatible. The associate may also be looking to gain experience, knowledge, and additional training, while the employer may be looking only for hours to be covered so they can have more time off. And if that's the situation, this clearly is going to become an issue at some point. The associate dentist will become an important part of the practice and your team. It seems that most people enter into a relationship only considering their own wants or needs. Of course, that is important, but you must consider the other person for a relationship to really work. We've all heard this, but it's easier said than done sometimes. Do the candidate's answers to your interview questions align with your objectives? You don't want any surprises later. Someone once gave me the advice to interview someone as if they would be your employer. Ask yourself if this is someone you would like to work for. After the interview, if you're interested in the candidate, express it, and then offer a working interview, if possible. This should be considered just an extension of the interview process, something you always want to do. You can allow the candidate to spend time with your staff and patients, and this will enable you to evaluate their skills and personal interactions. Don't have them come in to do a working interview without evaluating them, though. I've actually had candidates come to a working interview, and the practice owner isn't there to observe. This may tell both of you whether this is a good fit before making that leap of faith. So take advantage of it. Most associate employer issues can be resolved with discussion and compromise, just like for anybody. But conflicting philosophies can destroy a good working relationship rather quickly. To avoid personality conflicts, you may want to use a personality test. You want to get your staff involved in the hiring process because you know they can make a difference in the well-being of your practice. They know your personality and probably can determine if you are compatible with the associate candidate, perhaps better than you. Invite the prospective associate to meet with you and your spouse or significant other. They may be able to determine if this is a good personality match for you as well. Your goals align with the associates. More importantly, understand the associate's expectations and plans for the future. Is the associate looking for a short-term position? Are they planning to relocate due to a spouse or a significant other's job or education? There's no room for misunderstandings here. The goal is to result in a win-win situation for you both. This is where you can help. Teach them your business, especially if you want a partner or to transition your practice. That will only help you in the long run. Understanding the various components necessary to operate the business side of a dental practice is the best indicator of future success as a partner or owner. So help them understand that and learn it. In speaking with many of our customers, due to the COVID-19 crisis, they are considering all of their options, adding an associate, selling their practice, or bringing in an associate to take over the practice. If an associate starts working for you with the intention of eventually owning the practice or buying into the practice as a partner, they get to try it before they buy it. And this gives them a chance to actually work with their partner before they buy into the practice. And it's a great idea. It's a great plan. If the associate is planning to own in the near future and you do not want to offer any ownership, then you should plan on that associate leaving. There's no reason for them to want to stay. I'm surprised by the dentist owners who come to me after their long-term associate buys into the practice. They left their practice and went and bought another practice, and now the employer wants to offer an ownership opportunity to a new associate. They probably just had the best dentist for that opportunity leave them. For a buy-in, you need to come up with a plan on how you will determine the purchase price. Will you offer a percentage of the practice or a portion of a group practice with 3 or 4 other owners? If so, you need to have an agreement on how the income compensation will be split amongst the partners. Some of you may already have a partnership agreement with someone, but as you offer new associates opportunities to buy in, you need to have a new plan. One complaint I hear from practice owners who offer partnerships is that they produce much more than their partner, but the agreement allowed for an equal distribution of the net profits. If the purchase price is agreed to before employment starts, about 75% of all buy-ins and buyouts occur as planned or promised. If the purchase price is not agreed to before employment starts, only about 10% of the buy-ins and buyouts occur as planned or promised. So it's imperative that both parties agree on the value of the practice. It will prevent any dispute later on. For some senior dentists, the ability to mentor a new dentist is exciting. Many owners I've worked with really enjoy helping a new dentist begin his or her career. As a mentor, you must be patient, though. The associate probably will not start their dental career at the same level as a practice owner of 20 years or more. They may need time to grow. And if you mentor an associate, they may be grateful and more loyal to someone who has helped them and considers their future rather than just employs them. So it might be a benefit to you as well. If you're not available to mentor, if you're just too busy, possibly you have an experienced dentist working the practice that could mentor for you. Or assign one of your experienced staff members, the dental assistant or the hygienist, to work closely with the associate. They could help train them without an issue. A dental assistant can be a great mentor. If you are the hiring dentist, you may be expecting to find someone who will solve all of your problems. You want to cut back on doing dentistry, or you are too busy and ready to reduce your workload. You have visions of the new associate stepping into the role seamlessly, taking on management responsibilities, attracting new patients, and helping the practice grow its bottom line. But you need to be realistic. If the associate and practice owner have different ideas about providing good quality dentistry, which I hear sometimes, possibly suggest the associate take additional CE courses or whatever. And perhaps you could, pay them for the time off and pay for the courses. This will ultimately benefit the associate and the practice. Many times it's just a difference in ideas of how things should be done. So you're ready to make an offer. You want to agree on everything verbally, but put everything in writing. It's beneficial for both parties, and it can eliminate many disputes. Then prepare an employment agreement. If you offer a position to an associate, send them a contract review in a timely manner. By agreeing to everything before retaining an attorney to prepare the agreement, you can save on time and cost. Also agree on a deadline for a time to accept. Unfortunately, I've seen this process drag on for months or even long enough for one of the parties to just move on. Ask an attorney to review an employment agreement or a practice purchase sales agreement. The employer should fulfill any verbal promises made to the associate in the written agreement. The attorney should have knowledge of the dental business. That's helpful because the dental business is different than any other type of business. You need to communicate after you've hired the associate as well. It doesn't stop at the interview. Recognize that all relationships have their ups and downs. Have regularly scheduled meetings with your associate. Don't wait until there's a problem to communicate with them. At that point, it could be too late, and oftentimes it is. So what HSNDO does for dentists? That's us, Henry Schein Nationwide Dental Opportunities. We have clients that come to us because they want the right and best associate. We're a national organization. We have thousands of positions that we've filled successfully. All searches are strictly confidential. We have available candidates and conduct custom searches. We are backed by Henry Schein because we are a part of Henry Schein, the global organization. We're a Fortune 500 company, the largest dental distributor in the U.S., and we're named one of the 2020 World's Most Ethical Companies by Ethisphere for the 9th consecutive year.
So now we're going to have time for some questions and answers. Dr. Scammon, who's going to ask the questions, and then we're going to discuss them. Dr. Scammon?
Hi, Cindy. Thanks for having me.
Thank you.
Oh, my first question was, how do we maintain compensation and profitability during both hard and soft opening strategies? And how would this affect the new hire? They're kind of coming on in a different time frame than other people have come on in the past.
Yeah, I know. It's a little difficult. And I can only speak from a recruiter's point of view. So what I am seeing is that many of the associates who are planning to begin working are now only starting on a part-time basis. So the practice is back up and running and performing at a level that it was prior to the COVID-19. Obviously, then you can add hours and days to the new associate schedule as your patients start to return to the practice while, maintaining some sort of profitability.
And one of the things that we noticed is that when we hire a new associate, unlike in the past, insurance companies seem to have a lot more to say about whether or not somebody's a dentist now or not, as far as collections are concerned. When I started 30 years ago, you came out, you were a dentist, and you put your name at the bottom of the form, and that was the end of it. So we have our insurance companies online and ready to credential new dentists, and how much longer will it take to get credentialing with the backlog so that we can get collections back into the practice?
Right. I know it's an issue. But the good news is that many of the insurance companies are accepting a temporary license to offer credentialing, or at least to start credentialing. The credentialing is only good for a specific time as provisional credentialing. So they've set specific times to obtain the full credentialing. So some are giving up to like 180 days to get the regular credentialing. In researching this, it appears that once you submit an application, the credentialing process is still the same. So that's not going to speed up by any means. And we all know that takes anywhere from a few weeks to a few months. But the good news is they are working to at least address the situation right now.
And, they didn't have patients, or they had to shut down. Are dental schools and dental graduates still graduating on time?
Yeah, many of them are graduating or have graduated, but obviously they're performing their virtual ceremonies with a potential live graduation later in the year. So they should all be good to go here soon.
So has this affected how states give out licenses? Are they giving out licenses in a timely manner?
Some testing agencies they're offering the mannequin-based or computer-based licensing examinations for dental students to eliminate some of the human subjects, human interaction. Some of the testing agencies are still working on the logistics of all that and offering that type of test, but they are working to, stay away from having anybody interact with a person right now.
So my practice made no money recently, obviously, right? We were closed and emergencies barely paid the light bills. For the smaller practice owner or the younger practice owner, it looks daunting and expensive. And, how do you afford an associate at this time?
Right, I know. And unfortunately, we still have about 6,000 dental students who are graduating in 2020 that need a job. So, and obviously each state will decide individually about their guidelines for testing and license approval. But I think that this could take a bit longer to get licensed than in the past. But it's my opinion that they understand the need and are working on offering an alternative testing option. But to help the practice owners who have been closed and are just opening up, prior to the COVID-19, it was a little easier to determine if you were ready to hire an associate dentist. But now with all the changes, it can be a bit more challenging. So what we're hearing from practice owners, it varies. It varies from, I want to hire now to be ready for the influx of my patients when we open, to I don't want to go back into the practice at this time, but I'm not ready to sell. So in either situation, your needs depend primarily on your patients. Have you been in contact with your patients to reassure them of their health and safety in returning to the practice? Obviously, they need to know when you plan to reopen. Reach out to them to reschedule any missed appointments. Be sure to contact as many patients as you can by email, text, etc. There's some practice software out there that may help you with that in doing that. Once you determine your patient's needs, you should prepare a hiring plan. So as you prepare a plan, you want to ensure that you will have enough PPE to bring another dentist into the practice, because we all know that's an issue right now too to be concerned with. If you had planned to add an associate prior to COVID-19, you may still be able to do so. Your ability to add an associate is contingent upon your ability to manage your clinical time. So try to schedule full treatments in one time if possible. Again, if the associate is taking over the practice owner's schedule, so if it's the practice owner that's planning on not being there, these things are not going to be a concern. Okay?
Yeah, awesome. Thank you.
So this is my contact information. If you ever need our service or have any questions, please feel free to contact me. I'd be happy to talk with you. Again, I want to thank Dr. Edward Scammon for his great questions tonight. I'm sure he shares some of the same concerns as many of you who are considering your options for the future. I wish you all well. Have a good night.
Thank you, Cindy and Dr. Scammon, for the presentation and Q&A session. And thank you, everyone, for attending today's webinar. If you have questions that we did not answer during the presentation, please email us at ndo@henryschein.com. Everyone attending today's webinar will receive the recording in the coming week via email. On behalf of Henry Schein Dental Business Institute, thank you for attending. Have a great night.